Welcome to Final BDS Made Easy. I'm back with another video containing the 1 markers from cons and endo for your final year BDS exams. First question is zinc in amalgam. Zinc in amalgam acts as a scavenger for oxygen during the manufacturing process, reducing the oxidation of other metals and enhancing the longevity and integrity of the amalgam restoration. Silane. Silane is a coupling agent used in dental composites to enhance the bond between the inorganic filler particles and the organic resin matrix, improving the mechanical properties and durability of the composite material. Third question is smooth surface caries. Smooth surface caries occur on the flat, smooth surfaces of teeth without pits, fissures, or grooves, and are caused by the accumulation of plaque and bacteria in areas that are difficult to clean. Fourth question is diagnosis of cracked tooth. Diagnosis of a cracked tooth involves careful clinical examination, including assessment of symptoms such as pain upon chewing and discomfort when releasing biting pressure. Specific diagnostic aids like magnification tools and transillumination techniques are used to locate and evaluate the extent of the crack. Bite test can be done using a tooth sleuth or frac finder. Fifth question is internal walls. Internal walls refer to the inner surfaces of cavity preparations that are prepared to facilitate retention and resistance form for restorative materials, ensuring longevity and stability of the restoration. Sixth question is iontophoresis. Iontophoresis involves the use of a low-level electrical current to facilitate the delivery of ions of therapeutic agents such as fluoride into the tooth structure. This technique enhances the uptake of ions, promoting remineralization and strengthening of dental tissues. Seventh question is rapid separation. Here the tooth movement is achieved rapidly over a short period of time. It may be achieved by wedge principle or traction principle. ART. ART is a minimally invasive approach in conservative dentistry that involves the removal of decay using hand instruments alone, followed by the application of a restorative material like glass ionomer cement restoration without the use of rotary instruments or local anesthesia. It is particularly useful in resource limited settings or for patients with dental anxiety. Question is reversible pulpitis. It is a mild to moderate inflammation of pulp caused by noxious stimuli in which the pulp is capable of returning to the normal state following removal of the stimuli. Treatment involves conservative measures such as applying desensitizing agents or performing indirect pulp capping to preserve the pulp vitality. Question is pulp degeneration. Pulp degeneration refers to the breakdown of dental pulp tissue, often due to aging or mild irritation. It is initially asymptomatic and progresses with tooth discoloration and loss of responsiveness to tests. Common causes include attrition, abrasion, erosion, operative procedures, caries, pulp capping, and irreversible pulpitis. Question 11 is percussion test. This test enables one to evaluate the status of the periodontium surrounding a tooth. The tooth is struck a quick moderate blow initially with low intensity by the finger and then with increasing intensity by using the handle of an instrument to determine whether the tooth is tender. Next question is barb broach. A barb broach is one of the intracanal instrument with tiny projections or barbs along its shaft meant for single use only. It is used in extirpation of entire pulp tissue and its ADA specification number is 6. 13th question is tuckback. Tuckback is a slight resistance to pull of the gutta percha master cone when it is removed from the canal. It is a subjective tactile indicator that cannot be quantitatively measured. 14th question is major diameter. It is the main apical opening of the root canal and it is frequently eccentrically located away from the anatomic or radiographic apex. 15th question is sodium hypochlorite. It is a reducing agent, a clear straw-colored solution containing about 5% of available chlorine, and it is the most widely used irrigating solution. 16th question is granuloma. A granuloma is a chronic inflammatory response characterized by the presence of granulation tissue around the apex of a tooth with a necrotic pulp. It typically forms as a result of chronic irritation or infection of the periapical tissues and is often associated with asymptomatic or minimally symptomatic periapical lesions. 17th question is sprue. A sprue former provides a channel for the molten metal to flow into the mold space in an invested casting ring after the wax pattern has been eliminated. Next question is the C factor. C factor refers to the cavity configuration factor, which is the ratio of bonded to unbonded surfaces in a cavity preparation. It influences the polymerization shrinkage, stress of composite materials, affecting the longevity and integrity of the restoration. Next question is tunnel restoration. The tunnel restoration was first described by Jenks in 1963 as a conservative alternative for class 2 cavity preparation in primary molars. Later, Hunt and Knight modified the technique for restoring small proximal caries using glass ionomer cements in deciduous and permanent teeth. In tunnel preparation, marginal ridge and proximal surface enamel are preserved. Question is GMT. Gingival marginal trimmer is used to produce proper bevel on gingival enamel margins of proximo-occlusal preparations. The blade is curved and primary cutting edge is at an angle. There are two types, mesial and distal. They are used for rounding or beveling of the axiopulpal line angle of two surface preparations. Next question is cavity varnishes. A varnish is a synthetic resin dissolved in an organic solvent like acetone or ether, which when applied onto the tooth surface, the organic solvent evaporates, leaving behind a protective film. thickness of a varnish ranges from 2 to 5 micrometers. Enameloplasty. It is a prophylactic procedure that involves the removal of a shallow enamel developmental fissure or a pit to create a smooth saucer-shaped surface that is self-cleansing or easily cleaned. Number 23 is slots. Slots refer to prepared spaces or grooves within a tooth structure, often created to enhance the retention of restorative materials such as dental amalgam. They help improve the mechanical bonding between the restoration and the tooth, and it is a secondary resistance and retentive feature. Question number 24 is tooth separator. Tooth separator is a pointed wedge-shaped device that is inserted between teeth to produce the desired amount of separation. Examples are iliac separator, wedges. Thank you for watching. If you appreciate the video, do hit the like button and please subscribe to my YouTube channel. Stay tuned for more such videos.